Hao Wu is one of the directors of the documentary 76 Days, which chronicles the initial lockdown that occurred in Wuhan, China, through the point of view of several hospitals in the area. And this occurred during the beginnings of the COVID-19 pandemic. How were you able to get access to filming in these four hospitals situated around Wuhan?
I was actually in New York through the production process. I'm based in New York, and I reached out to filmmakers who had started filming in Wuhan in early February. That's how I found my two co-directors. So both my co-directors are reporters. During the lockdown, the hospitals in Wuhan were restricted. The access to the hospital were restricted to medical workers, patients, and reporters only. And one of my co-director, Wei Shi-Chen, he's a video reporter for Esquire China, but he wasn't sent by Esquire China to cover the lockdown because that wasn't Esquire's usual beat. He's an aspiring filmmaker himself, so as soon as he heard about the lockdown, he found a way to embed himself with a medical team that was sent from elsewhere in China to support local hospitals in Wuhan, because he traveled to Wuhan with the medical team. So the hospital thought he was part of the medical team and allowed him access. So my other co-director, Anonymous, he's a photojournalist for a local newspaper because he had known all these hospitals all these years. So he basically, went to the hospitals and asked to take photos and do reporting. The thing is that during the early days of the lockdown, because the situation in Wuhan, it was basically in late January. The situation in Wuhan was extremely chaotic, and the hospitals were overwhelmed, and the hospital also running out of PPEs. So some hospitals actually welcome reporters to come in to do reporting, so people outside of Wuhan could know what was truly happening and be able to donate PPEs to these hospitals.
You mentioned that one of the other directors credited on it is listed as anonymous. Are you able to go into why he or she is credited as anonymous rather than using their name without revealing anything, not necessary?
Yeah, absolutely. So I think it just starting in March, because the Trump administration really started the media campaign accusing China of starting the whole thing, calling the virus China virus, Wuhan virus, and China, starting in March, increasingly trying to control the COVID narrative and the COVID narratives coming out of China. So obviously, even though during production, after much discussion, we decided that we really want to, because what's being captured on camera by my two co-directors are really the human stories on the ground, the individual stories of how people can help each other, to support each other to live through this catastrophe. But even though we decided we're not going to make a political film, but still, Anonymous, since he had only worked for state-owned sort of media companies before, he was still very wary of displeasing the government in any way, because the government might find problem with how we portray the early chaos, or so the immense tragedies happening during the lockdown, and also increasingly in China, on China's social media, there's a growing numbers of nationalistic trolls. So they view anybody who's now working directly with the government who portrays China in any way negative, they will accuse, so they will start all these kind of online personal attacks and the troll attacks. So he's really worried about that. He didn't want to lose his job because that's the only job he's ever had. So that's why, even though Wei Shi-Chen, who lives in Beijing, a big city, and always worked for commercial publications in China, he opted to to show his identity, disclose his identity in the film. But my other director decided to remain anonymous.
So you're talking about the issues with and people working for state-run media. Censorship is always an issue with China, and I was curious as to whether there were any issues or concerns about censorship or the potential for it from the Chinese government towards the footage that was shot.
I think with the footage, because my co-directors every day, they just back up the footage up into a cloud service. I just downloaded from the cloud servers in New York. So we haven't run into any problems with the, sort of like the stopping of the physical media, because on other projects, sometimes my collaborator in China would ship media drive to me, and that would, more often than not, they will be stopped at the customs. But in terms of censorship, I think the reason we decided to really work under the radar, because before we announced the film, the premiere at Toronto International Film Festival, only about 5 people knew about the existence of the project. We really wanted to basically not to let anybody know we're working on this. And even after its premiere in the early month, as we monitored the audience response, we declined all interview requests from Chinese language media, primarily just to protect my co-directors in China. But so far, I think the response among the Chinese diaspora overseas who have watched the film has been pretty positive. They recognize what we're trying to do, which is really focus on the human story. So far, we haven't run into any issue with the Chinese censors.
One of the interesting things in the film, and you'll have to forgive me, it's been a little while since I saw the film, but from what I remember, we don't see any of the frontline healthcare workers, the doctors or the nurses. We don't actually see them. They're always covered by their personal protective equipment. And I was curious as to whether or not that was a conscious decision on yours and the filmmaking's team to not show them without that equipment on.
I think it's more because obviously we have captured them outside the contamination zone, right? Captured images of them without their masks on. But then those scenes were not as interesting or as emotionally dramatic. So that's why we just want to make sure every image on the screen, can convey some kind of can evoke some emotional response in the viewer. So that's why we just really limit the stories, most of the stories anyway, to what happens inside the ICU, inside the contamination zone. Only once we saw one of the nurses taking off her mask, and we saw her face for a second, and then she immediately put another mask on.
One of the things that I felt was subtly conveyed through the documentary also was that, to a degree, the communist ideology in China helped make the lockdown easier for the citizens to get behind. Is that something that you found to be true?
There's definitely a big difference between the society and the government's response to COVID-19 in China as compared to here. But I don't know whether it specifically has any much to do with communist regime. Obviously, China has an authoritarian regime, so for it to deploy resources, like, for example, sending tens of thousands of medical workers to volunteers into Wuhan to support a local hospital, that they could have done it fairly quickly. But at the same time, the more I think about it, I think it also has to do sometimes with the culture, with how historically what the relationship is between the population as well as the government. Like, for example, like in East Asia, right? Japan, South Korea, Taiwan, Singapore, and China, they have all dealt fairly well with controlling the pandemic outbreak, the local outbreaks. I think it's also because it has a lot to do with the Confucian culture, whereas people a lot of times review, and the government and the people has a more like a patriarchal relationship, and the population sometimes they defer to the authorities and follow orders much better than what our relationship with the government here in the U.S.
And it fell through at the documentary. You were concentrating on several specific patients that were like the through line throughout the whole thing. Of course, there was the couple with their infant daughter, and you also had the old man. Everyone called him Grandpa. But were there any other subjects who you kind of zeroed in on, but weren't able to keep it in the final cut of the film?
Yeah, I think in the early days of editing, we definitely we experiment with two things, right? One is that we have shot a lot more outside of the hospital. We shot a lot more volunteers and residents' life. We have actually also filmed 2 whistleblower doctors who basically against all pressure from above, they reported the cases to public health authorities. We also shot a dissident who trying to sue the government, but in the end, we decided not to include those in the film because most of those were like sit-down interviews. I think what's unique about 76 Days, especially what my co-directors have captured inside the contamination zone, is really about the, showing you almost what it feels like, what would it feel like to be in the eye of the storm, right? To be there to watch COVID-19 so up close and personal, to get those, so raw emotions. So we just feel like to include some of the other stories, which mostly told to sit-down interview, we just disrupt the, sort of the artistic style or the emotional flow.
Well, Hao, thank you so much for joining us. We wish you all the best during this awards season. Thanks for joining us on our panel today.